Can you tell me a little bit more about how health systems can get started with these programs?
Yeah, I think one of the misconceptions that we see is health systems always want a pilot, or they want to dip their toes into it a little bit. And it's an interesting conversation when we're first either starting with a new client or about ready to work with a new client, is that the pilot is just as much work to set up and implement as a full service. And so with health systems, what we've done really effectively is work within departments and treat those as almost like different customers. Even though it's part of the health system, you're going to do different activities to implement within internal medicine than you are with cardiology, or than you would with rheumatology or endocrinology. So we try to treat each specialty within a health system a little bit differently, with a cohesive plan in each department. And we might start that with a certain specialty or department or location. Just always a health system will have that clinic or those people that are usually the ones to try something new. And so that's where we try to start or ask. And if they want to call that a pilot, that's fine. But at the same time, just going with just a few patients and rolling it out with just a few providers actually doesn't usually equal more success. It just draws out the program a little bit longer. And the work to prop it up and to implement these programs is just the same as if you went with a whole site or specialty at the same time. And then when we do that, we can actually not only connect CCM, RPM, transitional or principal care management, but we can connect transitional care management. So post-discharge, getting those patients either enrolled or set up with devices for remote patient monitoring. And now we can connect the dots between discharge and the ambulatory outpatient centers. And that's where we can be most effective within a health system.
Yeah, that's super interesting, because we do see health systems, when they talk to us, they do want to start small. They do want to start with a certain department and fewer patients. But it makes sense that if you're spending time and money starting in a smaller group, might as well start across various departments. But yet it probably depends on the appetite that the health systems have to start a new program across multiple departments. I'm sure that can be challenging as well.
For sure. I mean, they usually have their targeted sites that they try new things with, and that's where we want to start as well.